COVID-19 specifically targets your respiratory system, both the upper respiratory system and the lower respiratory system. It first of all starts around here with the sinuses, the nostril, the back of the nose, the back of the mouth, the back of the throat, and then down to your throat, down to your windpipe. So it's extremely important that you understand what it takes to protect these parts. Obviously, you have to obey the NCDC requirements, the Federal Ministry of Health requirements, directives that you wash your hands, social distancing, make sure you watch whatever you touch, use your sanitizer and all those things. Very, very important. But also you want to ensure that you're taking the right things that are strengthening your respiratory system. And there are 3 or 4 things that we always recommend. 1, vitamin A. Vitamin A, obviously, because vitamin A is important for the development and the maturation of your lungs. And not just that, but also the protection and the recovery from injury. The other one is zinc, But zinc is really, really important. In fact, what they found out that 16%, what they found out is that 16% of all pneumonias are due to a zinc deficiency. So zinc is really important. Vitamin C is also very, very important. And I know I talk about vitamin C a lot. I mean, you cannot overstate it. Vitamin C is important, is critical for the lining of every single part of your body. The lining of the lungs, the lining of the windpipe, the lining of the gut, the lining of your heart and blood vessels. So vitamin C is really, really important. The key is that you take vitamin C sparingly throughout the day. You don't just take one bulk amount, because most of that will be wasted. And also there's a risk of kidney stones if you take too much at a go. But if you space it out, it's better. And of course, the last one is vitamin D. Vitamin D, we talk about that all the time as well. And we say that black people in general seem to have less lower levels of vitamin D than white people do. And I know we're in the tropical parts of the world, so there's a lot of sun, but not everybody is out in the sun for 1 to 2 to 3 hours and their body exposed. Most of us are fully clad, and of course in religious areas they are even more fully clad, so they don't get the vitamin D even though the sun exposure to the sun is there. So those 4, vitamin C, vitamin D, vitamin A and zinc, are extremely important to help to protect your respiratory system and hopefully get you through if at all you do contract the virus. We want to talk about some of the things you need to avoid while you're under lockdown now, because it can be very frustrating, I know. So when you're under lockdown, there are some things that you want to do while you're doing everything else. You want to move around. You want to be out in the sun. They say the best times to be out in the sun are between the hours of 12 noon and 3 o'clock. Other parties say maybe you should try 10 a.m. to 2 p.m. Anyway, either way, the sweet spot is 12 noon to 2 o'clock in the afternoon. Really, really important that you get enough sunlight. Sunlight is important not just to be happy and not just to get heat, but also to boost your immune system, because it raises your levels of vitamin D3. It also stimulates the production of nitric oxide, which is a gas that helps to produce more, helps to dilate and your blood vessels, makes your blood vessels relax and makes them dilate so blood can flow through. And one of the things we know is that hypertension is certainly the opposite. In hypertension, the blood vessels are not relaxed and they're constricted, and so the pressure is higher. So going out in the sun, especially exercising in the sun, walk around, running around, play table tennis if it's in your neighborhood, if it's in your house, between you and one other person, right? You want to maintain social distance. But come out in the sun, enjoy the vegetation, enjoy nature. You can't be cooped up in your room all day long. So please get healthy, get out, breathe more, and enjoy your life. One of the things we talked about in one of our shows on COVID-19 is the cytokine storm. Sounds sinister, and it really is. The cytokine storm is what really kills people and patients who have COVID-19. And the good thing is that 80% of the people who contract the virus will probably live, and they'll live without any long-term effects. Now, the 20% may require hospitalization, and the statistics still say 2 to 4% of those who have the active form of the virus or who have the active disease will die, unfortunately. But again, what kills these people is what is known as the cytokine storm. In one of our episodes, we talked about the cytokine storm in regard to COVID-19, and we talked about how that, more than anything else, affects and causes death in COVID-19 patients. Yes, it starts in the lungs. That's where it really causes damage, but it doesn't stay in the lungs. It affects multiple systems and multiple organs, especially the kidney, the liver, in addition to the lungs, and even the blood vessels, the blood cells themselves. So it's really, really important that we understand how to minimize the cytokine storm. And we talked about specific nutrients that you can use to build up your immunity, and also to so your immune system becomes strong and more effective and more intelligent, and it doesn't go haywire, which is really what happens in the cytokine storm. Your immune system goes berserk and starts destroying your own cells and your own organs and tissues. So it's really important that you be primed before getting the COVID-19 infection. And thankfully, 80% will survive and do well and get out of it without having any severe long-term effects. But you want to be sure that you are one of them, if at all you get the virus. The top 5 or 6 susceptibility factors, things that make you more prone to having the more severe form of COVID-19 and possibly causing death, are obesity. Yes, it is number 1 from what they've said. The elderly, 65 and above, those with hypertension, those with cardiovascular disease, those with chronic lung disease, and those with diabetes. These 5 or 6 factors they trump pretty much every other thing. And so it's very, very important that you take your medication, you listen to your doctor, but also it's important that you practice health habits, or good health habits. And many of these habits we've talked about in the laws of life. Some of the things that are coming out of the research in the United States, which is the world's hotspot for COVID-19, is that blacks have it much, much worse off than whites do. And they have several reasons for that. I'm just going to highlight a few things. Non-Hispanic blacks have 24.6 higher levels of vitamin D deficiency than whites, and 3.7 times higher vitamin D insufficiency than non-Hispanic whites. And by the way, vitamin D deficiency is when it is less than 20 nanograms per deciliter, and vitamin D insufficiency is when it's less than 30 nanograms per milliliter. So that's very important for you to know. Now, here's an interesting fact. Black people make up 13% of the US population. However, they make up 33% of people hospitalized in the US. However, white people make up 76% of the US population, and they make up 45% of hospital admissions. So 33%, 13%, 45%, 76%. You can see there's a clear disparity there. Here's another one. This is a study done in Sweden, Stockholm, Sweden. Somali immigrants living in Stockholm, Sweden make up 40% of COVID-19 related deaths reported at the time. Somalians make up, get this, 0.84% of the Stockholm County population. So the studies said the recommendation was that maybe we should be supplementing, or we should be providing supplementation of vitamin D for those living in the northern hemisphere, like those in Sweden. But in the US, yes, it's northern hemisphere as well, but what they found is that globally, black people have lower levels of vitamin D. So it might make sense. Might make sense to supplement with vitamin D, even in Nigeria, because vitamin D is really, really important for the immune system, not just for activation of the immune system, but also for control and modulation of the immune system.